Today we are presenting one pretty interesting MCQ. This is named the AimExcellence Bahubali MCQ. And after seeing Bahubali, Rajesh, the 44-year-old, went to the gym, especially eyeing to come in shape before Diwali, enthusiastically graduating from 5 kg, 10 kg, last picked up 40 kg for biceps curls and felt a snap. This is a very important point. Felt a snap. In morning, there is a swelling. There is pain which subsides a bit, and he came to you and you told jokingly your biceps is bulging. He gave a smile. Yes, but it is aching a bit. So pain is still persisting there. What will you suggest next to address the problem? Will you suggest him to continue his workout? Will you suggest to give rest, ice, compression and elevation? Will you go and suggest perform ludington test? Or go for MRI and suggest straight away? So we have to first see this particular picture. We have to first name the sign. This is known as popeye sign. This is known as popeye sign, and this is practically seen in biceps tendon rupture. This is seen in biceps tendon rupture. We have to remember one thing. The biceps tendon rupture is actually two types. Biceps tendon rupture is actually two types. One is proximal and another is distal. One is proximal, another is distal. And the proximal is the most, 90 to 95% of the cases. Here the patient is of 44 years old, so it is a middle-aged person. It's a 44-year-old and a middle-aged person. So in this kind of cases, where supination is not the most important issue, we are going to talk about the function of biceps too. Supination is not that much issue. We are going to go for the conservative therapy at the first attempt. So we have got till now, there is a popeye sign is showing out here, and we understood this is a biceps tendon rupture. We also understood there is two kind of biceps tendon rupture. One is proximal biceps tendon rupture, and another is distal biceps tendon rupture. This is a proximal biceps tendon rupture, and there is distal biceps tendon rupture, and the proximal is much more than the distal. And the age of the patient is also very important. Here the patient is of middle age, and therapy generally differs in young age, where the flexion and supination both hold the very important role. In those cases, if the conservative therapy is not yielding the desired result, those cases we go for the surgery. So first we will go for a conservative therapy, that RICE therapy that I've given, that rest, ice, compression and elevation of the arm, that will be given to control the inflammation and reduce the pain. We can give the analgesics also, but if it's not sufficient and the supination and flexion both are important. The function of biceps is supination and flexion both. So in those cases we'll go for the surgery. And here we are seeing little bit of bruises there. That can be seen in cases of acute cases. There will be bruise and there will be discoloration of the skin. That will be seen in this particular case. So there are quite a few tools we have to remember. In biceps there are two heads. There is short head, which is originating from the coracoid process along with coracobrachialis, and another is long head, which is originating from glenohumeral tubercle. The nerve supply is musculocutaneous nerve, and it is terminating in inserting in radial tuberosity. Biceps is the most superficial muscle in the anterior compartment of the arm, and apart from biceps, there are two other muscles, coracobrachialis and brachialis. And in the middle of the humerus, there will be form a single muscle mass. This is a single muscle mass. And what is the function of tendon? Tendon, where the muscle mass is connecting it with the bone itself. So the function of tendon is connecting the muscle with the bone. This is the picture of the distal biceps tendon rupture, which is a pretty rare. This is distal biceps tendon rupture, and in most cases of distal biceps tendon rupture, which is seen in mostly athletic and weight bearing people who are doing the heavy weight and young age, in those cases surgery is seen required. In most of the cases surgery is required, but that is not the case here. So we can go for the conservative treatment as a treatment option. Lastly, we have to see, this is the proximal tendon rupture. This is the proximal tendon rupture, and we know by now the long head is mostly ruptured than the short head. Short head rarely ruptures. And this is the Ludington test. This is Ludington test. This is to elicit the location of the pathology. Here, the both arms and the palms, the fingers are jointed at the back of your head, and there you try to contract and relax your biceps muscles, and the examiner try to press it to see whether there is any kind of tenderness there or not. And if there is tenderness is there, so then it is going to be positive. So this is Ludington test. See how. So apart from Ludington test, few other tests are there, like speed test, Ergason test, and O'Brien test. And one important thing about O'Brien test, it is also talk about slap tear. Means in cases of proximal biceps tendon rupture, generally other muscles are involved too. We have to exclude that, and the slap tear is one of them, and which is best elicited by the O'Brien test. All these tests can be asked in the future MCQs. These are not being asked till now, but it can be future MCQ point question. This Ludington also can be future MCQ points. I hope you have liked this particular presentation, and if you like this particular presentation, follow us in the Facebook, Twitter, and YouTube. And I want to know your feedback. Just post it in our AimExcellence pages in the Facebook. We want to know how much you like this particular video. Thank you.